you, Mr. Chairman. Let me just start by thanking you for holding the markup. It's been refreshing to have a committee process that moves forward with hearing individual members present their ideas at the open hearing forum and have that legislation move forward to solve actual problems for our constituents. People want choice and flexibility when it comes to health care for themselves and their families. They want to be empowered to shop around for the best quality care at the lowest cost, like they can do with anything else that they buy. And that's why more than 800,000 Minnesotans have opted for an HSA-eligible health plan. And Minnesotans aren't the only ones who are using these accounts. Nearly 20 million Americans today now have an HSA-eligible plan. And HSAs should be a central component of a patient-centered health care system. And while these accounts are working, it is important that we look at ways to improve these popular accounts so that we can further empower patients as consumers. This bill, the Health Care Security Act, is a common-sense way to improve HSAs for individuals and families as they look to save for future health care expenses. The Health Care Security Act does three simple things. Number one, it improves a couple's ability to make catch-up contributions. Under current law, if both spouses are HSA eligible and are age 55 or older, they're allowed to make catch-up contributions to save and pay for all the health care expenses that come with getting older. But catch-up contributions, we know, are also important because while Medicare will pay for as much of a senior's health care costs, a study also found that an average couple turning 65 will need to find somewhere around $250,000 to pay for their health care costs for the rest of their future. And that's a lot of money. And as a result, nearly 20% of Americans aged 65 and older are still working. However, under current law, catch-up contributions must be deposited into separate HSA accounts, even if both spouses are eligible to make these contributions. It's unnecessary and makes saving and operating the accounts more complicated. So this bill simply streamlines HSAs by allowing both spouses to deposit their catch-up contributions into one account. The second provision addresses the uncertainty created with changing health care plans during open enrollment. Under current law, a taxpayer may use HSA funds only for qualified medical expenses incurred after the establishment of their HSA. Upon enrollment in an HSA qualified health plan, a patient may immediately incur medical expenses, but they would not be able to use their HSA funds to pay for the expenses if that account isn't already open. This applies even if they're already in the process of setting up the HSA account. So this bill simply gives families the flexibility by treating HSAs opened within 60 days after gaining coverage under their health care plan as having been opened on the same day as the plan. It's a reasonable grace period to let people set up their HSAs and then pay for any health expenses that come up while they're setting up that account in that process. And finally, Mr. Chairman, the third provision merely gives individuals and families more flexibility and financial security to cover their health expenses, and that's something that we all should support. And it does this by raising the cap on the annual contributions to an amount that covers out-of-pocket costs and deductibles for an individual's health care plan. So, Mr. Chairman, in conclusion, HSAs are a very important way to empower consumers and reduce costs, and the Health Care Security Act provides these three common-sense fixes to improve HSAs and give families and individuals more ability to save and pay for their health care expenses. And I yield back.